Audiology in veterinary medicine is a concept that is still not fully developed today. In veterinary practice, audiological studies are generally performed by neurologists, and general practice veterinarians rarely deal with audiology. Normally, they base their diagnosis on the assessment of inflammation of the ear, the presence of otitis externa. They evaluate whether there are clinical signs of otitis media, but they may not pursue a complete assessment of conditions that affect the tympanic membrane or conditions that can affect the animal's hearing. The diagnostic instruments that are normally available are very simple. We have an otoscope with various size cones that allow you to view the vertical and horizontal ear canal as far as the tympanic membrane, and this can be done when the animal's ear is healthy. When we are faced with a sick animal and we have an inflamed external ear canal, most of the time it is not even possible to proceed with an otoscopic investigation and examination. So we are limited to a cytological evaluation of the ear. And that's pretty much all that can be done at the very first level in general practice. There are more complex complementary examinations that can be made. A bacteriological examination to find susceptibility to antibiotics, or diagnostic imaging, CT or MRI, that will give an evaluation of what is not visible in the ear. Essentially, these are conditions of the tympanic bulla. But we still do not have tools like those available to the ear, nose and throat doctors to evaluate the tympanic function and tell if the eardrum is normal or perforated. And this was the situation up until only recently. And now we have a veterinary tympanometer introduced into the market. This is VetWave. The tympanometer consists of a handheld probe that can be easily inserted into the external ear canal of the patient, with its tip being protected by a snug-fitting rubber cap. The tympanometer is able to evaluate the eardrum by harnessing a very quick and simple investigation using a flow of sound waves directed towards the eardrum, which then gives us an evaluation of the physiology of the eardrum. And this is a very important first step. VetWave can be used daily in clinical practice, as a part of a routine screening program, or whenever you need to perform an otoscopic examination of a patient. By doing this, after you have assessed the morphology of the ear canal, we can gather the tympanic function through the tympanometric test and get data on the patient's physiology. In healthy young dogs, we can begin to collect a clinical baseline, a sort of audiological ID of the patient's ear, allowing us to monitor its audiological health over time, when it could perhaps develop tympanosclerosis, or, for example, following an inflammatory episode. I use VetWave frequently to monitor patients with recurrent otitis externa. And when these patients are now recovering from the inflammatory component and the microbial overgrowth that was present in the ear, it is also very interesting to perform the test to get information on the presence of tympanic rigidity or tympanic flaccidity, or the presence of lesions or lacerations that were not seen in the initial examination due to a severe inflammatory reaction. VetWave is for everyone. It is a very simple instrument to use and does not require a long learning curve. There is no difference in the capability and dexterity of a specialist or a novice in their ability to correctly insert the probe into the ear canal and then evaluate the results. It is an instrument that has an application in all clinical practice, not only at a specialist level, but in any clinic.
esperienza sul campo è stata un po' variegata, nel senso che
my experience in this field is very varied. I use VetWave mainly to monitor recurrent otitis externa, but also in specific conditions such as when the patient has had neoplasia inside the ear canal, which was then treated by using video endoscopy and a laser. And the tympanometer helps me a lot with the immediate monitoring and also over time in the assessment of the type of scarring, for example, that can happen in the region of the eardrum. The advantage of VetWave is that it not only provides a simple evaluation of the recorded parameters and curves, but it carefully assesses all of the measured parameters to obtain a refined differential diagnosis list, and therefore you have more details on the possibility of any damage inside the middle ear. We all know that otitis externa often evolves into otitis media, but the veterinarian will diagnose otitis media only when the patient has clinical signs. The advantage of VetWave is that it gives an early diagnosis, and it understands that the eardrum's involvement is already a first sign of middle ear inflammation. The advantages are not only for the clinic, but also for the client, because an even more complete service is provided, which will allow for an early understanding that the patient has a tympanic lesion, even before the potential administration of an otological product that could be ototoxic for the pet. And it's a screening test that can be done before deciding to perform more sophisticated and expensive investigations such as CT and MRI that could impact on the client's decision. Because tympanometry starts off by giving good and important data at the very first visit.